Assalamu alaikum, I'm Dr. Asad Saleem here. I discuss about Meconium Aspiration Syndrome, or MAS, is a respiratory condition affecting newborns. It occurs when a baby inhales a mixture of meconium and amniotic fluid, the fluid surrounding the baby in the womb during labor or delivery. Meconium is the baby's first stool, a sticky green-black substance. Babies with MAS may exhibit various clinical features. These can range from mild respiratory distress to severe breathing difficulties requiring immediate medical attention. Common signs include rapid breathing, grunting sounds during exhalation, and a bluish discoloration of the skin, known as cyanosis. In some cases, MAS can lead to complications such as pneumonia, pneumothorax, which is a collapsed lung, or persistent pulmonary hypertension of the newborn, often referred to as PPHN. Prompt recognition and treatment are crucial to minimizing the risk of these complications and ensuring the best possible outcome for the affected infant. Several factors can contribute to the development of Meconium Aspiration Syndrome. Fetal distress, often caused by problems with the placenta or umbilical cord, can lead to the baby passing meconium before birth. This increases the likelihood of the baby inhaling the meconium-stained fluid. Premature rupture of membranes, or PROM, where the amniotic sac breaks before labor begins, is another risk factor. Prolonged labor or difficult delivery can also increase the chances of meconium passage and aspiration. Babies born to mothers with certain medical conditions, such as diabetes or high blood pressure, may be at higher risk of MAS. Additionally, babies born after 40 weeks of gestation, known as post-term babies, have an increased risk of meconium passage and aspiration. Diagnosing Meconium Aspiration Syndrome typically involves a combination of clinical evaluation and diagnostic tests. The doctor will assess the baby's breathing, skin color, and overall condition. They will also inquire about the mother's medical history and the circumstances surrounding labor and delivery. A chest X-ray may be performed to visualize the lungs and check for signs of meconium aspiration. The X-ray may reveal patchy areas in the lungs, indicating areas of inflammation or infection. Blood tests such as arterial blood gas analysis can help determine the baby's oxygen levels and acid-base balance. These tests provide valuable information about the severity of respiratory distress and guide treatment decisions. Treatment for Meconium Aspiration Syndrome depends on the severity of the condition. Mild cases may only require supportive care such as supplemental oxygen and close monitoring. In more severe cases, babies may need to be admitted to the Neonatal Intensive Care Unit, or NICU. Mechanical ventilation may be necessary if the baby is having difficulty breathing on their own. This involves using a machine to assist with breathing. Antibiotics are often given to prevent or treat infections. Prevention of MAS primarily focuses on reducing the risk factors. Careful monitoring during labor and prompt medical intervention when necessary can help prevent fetal distress. Early detection and management of maternal medical conditions can also contribute to reducing the risk of MAS. If you enjoy keen knowledge about this video, make sure to like, comments, share the video and subscribe at Asad Saleem 1414 for more medical insights.